This is an ABC News special report.
I'm Whit Johnson in New York, and we're coming on the air because President Biden is about to give remarks updating Americans about COVID for the first time since the State of the Union address. He's coming before the cameras as the new Omicron subvariant, BA.2, becomes the dominant strain in the U.S., making up nearly 55% of new COVID cases. The CDC greenlighting a second booster shot for people 50 and older, available 4 months after the first booster. The president will be receiving his second Pfizer booster shot after his remarks here today. Biden's first booster was also the Pfizer shot, which he received back in September. President Biden expected to focus on the launch of a new website, COVID.gov, designed to give Americans better access to things like vaccines, tests, treatments, and masks, along with updates about COVID outbreaks in your area. They're billing this as sort of a one-stop shop website. There were other websites before for things like testing and vaccines. The idea here is to combine it all into one convenient place for Americans. The White House also urging the need for more COVID funding, which is especially essential to test and treat millions of Americans who don't have health insurance. As we're waiting for the president here, that funding has been stalled in Congress. And it's something that is really important when you look at things like people who are uninsured going to get a vaccine, going to get testing. Some of that funding for those programs is already starting to run out. The president expected to send an urgent message to Congress, to Capitol Hill, to get them to act. As we're here just waiting for the president to come up to the podium, I think we have another minute here. I want to bring in our Dr. Jen Ashton, our chief medical correspondent here, who's at the desk with me while we're waiting. We also are told, as we noted there, the president's going to get that booster shot, that second booster shot today. A lot of people wondering whether they should or should not get this, and there's not widespread agreement within the scientific community on this.
No, there isn't, and maybe we'll get clarification.
We'll come back to that. Let's listen to the president.
Today, I'd like to update you all on where we stand on COVID-19. Because of the strategy we executed over the past year on vaccinations, testing, treatments, and more, we're now in a new moment in this pandemic. Does not mean that COVID-19 is over. It means that COVID-19 no longer controls our lives. That's what it means. Cases are ticking up, as we thought they might. But now, thanks to the foundation we've laid, America has the tools to protect people, all people. And, as we've done from day one, my administration is making it easier than ever for Americans to access these tools. Today, I'm announcing the launch of COVID.gov, a one-stop shop where anyone in America can find what they need to navigate the virus. Free vaccines and boosters, free at-home tests, high-quality masks, and for the latest information about the level of COVID-19 spread in your community, you can get that immediately. Now, you'll also be able to find our new Test to Treat locations, which I announced in my State of the Union address. These are pharmacies and other places in your neighborhood where you can get tested, and if you're positive, you can get life-saving treatments all in one stop. We've already stood up 2,000 test and treat sites across the country. We're also we have nearly 200 sites just to serve military families and veterans communities as well. We've done what we've done throughout the pandemic. We've ensured these locations are at the hardest hit, hardest to reach communities as well. The bottom line, no longer will Americans have to scour the internet to find vaccines, treatments, tests, or masks. It's all there. And just go visit COVID.gov. COVID.gov. And I'm going to remind you, when I took office about 14 months ago, the pandemic was raging, the economy was reeling, and the deficit was soaring. Most schools were closed. We didn't have enough vaccines. The unemployment claims were sky high. And then we got to work and we delivered. Enough vaccines for every American months ahead of schedule. Effective treatments, at-home tests that are free and accessible. Over 99% of our schools are open again. Businesses are open again. And because of how we responded, we created more jobs last year than ever before, 6.7 million jobs. And by the way, we did it while cutting the deficit, the largest one-year deficit reduction in American history, Say that again. The largest one-year deficit reduction in American history. But none of that happened by accident. We're able to do it because we coordinated across the government, partnered with state and local leaders, governors on both sides of the aisle, and the private sector to leverage every resource we had to fight against this virus. We left no stone unturned, and we were able to do it because Congress worked with us and provided us the necessary funding. But now, just as we've reached a critical turning point in this fight, Congress has to provide the funding America needs to continue to fight COVID-19. We're already seeing the consequences of congressional inaction. The monoclonal antibody, take monoclonal antibodies, for example. They've helped save lives. This isn't partisan, it's medicine. But Congress hasn't provided enough money to keep purchasing these monoclonal antibodies. We've had to cancel planned orders and cut the supply we're sending to the states. Without more funding, we'll start to run out of them by the end of May. We've also had to scale back our plan to purchase more preventive therapies for Americans who are immunocompromised. Critical tools to protect the most vulnerable among us. Without more funding, we risk running out of the supply by this fall. The same is true of testing. It took months to ramp up our testing capacity. The Omicron, we saw how vital, and with Omicron, we saw how vital it was. And we have enough tests on hand to weather the surge. But without funding, we're not going to be able to sustain the testing capacity beyond the month of June. And if we fail to invest, we leave ourselves vulnerable if another wave of the virus hits. Look, on vaccines, and most important tool in this fight, we're also running a risk. Yesterday, the Food and Drug Administration, the FDA, and the Center for Disease Control and Prevention, the CDC, authorized the fourth shot for those 50 years and older. We know boosters are critical to providing an additional level of protection. That's why I plan to get my second booster today, right here after I'm done speaking. If you haven't gotten your first booster, please don't wait. Do it today. Those who are 50 and older, as well as those who are immunocompromised, can now get even more protection than they have from the initial first doses. We have enough supply to give booster shots to those newly eligible individuals. But if Congress fails to act, we won't have the supply we need this fall to ensure the shots are available free, easily accessible for all Americans. Even worse, if we need a different vaccine for the future to combat a new variant, we're not going to have enough money to purchase it. We cannot allow that to happen. Congress, we need to secure additional supply now. We can't wait until we find ourselves in the midst of another surge to act. It'll be too late. And we also need this funding to continue our efforts to vaccinate the world with commitments we made. It's critical to our ability to protect against new variants. There's no wall you can build high enough to keep out a virus. Congress needs to act now, please. Let me close with this. I've worked so hard to get our lives, all of us have worked so hard to get our lives back. We're summoning every ounce of American resilience, pulled every lever of our government, called upon the goodness, decency, and patriotism of American people. Together, we turned an unthinkable pain into an extraordinary progress and purpose. Americans are back to living their lives again. We can't surrender that now. Congress, please act. You have to act immediately. The consequences of inaction are severe. They'll only grow with time, but it doesn't have to be that way. We've proven what we can do when we work together. So I urge Democrats and Republicans to get this done with urgency. Let's stand united. Let's continue to pull together. Let's get this done. Thank you, and God bless you all, and may God protect our troops. And I'm going to get my second booster shot. I'm not sure why I'm doing it on stage.
President Biden speaking from the White House there.
Mr. President, what is the danger of Putin being left in the dark by his military advisors?
I'm reluctant to comment.
Can you comment on the declassified intelligence that he doesn't trust his military leadership since it is declassified?
No, can't.
Provide security guarantees to Ukraine as part of peace talks.
Doing great.
Is the U.S. willing to provide security guarantees to Ukraine as part of peace talks?
All right.
Mr. President, are you going to extend Title 42?
We'll have a decision on that soon.
What did President Zelensky tell you about the...
Reach and four countries of vaccination will impact the fight against COVID here.
What did President Zelensky tell you about...
Somebody asked me about the vaccines. Wonderful.
Mr. President, what did you hear from President Zelensky today about negotiations with Russia?
I've always thought that...
Perhaps as expected there, President Biden talking about COVID from the White House, also fielding questions from reporters about Ukraine and a variety of other issues. But there the president getting his second booster shot, his fourth shot total, the Pfizer vaccine, after speaking about the urgent need for Congress to act and increase COVID funding as the country enters the next phase of the pandemic. Let's see if the president answers some more questions here.
See if I can get to see them.
Today?
They're good people. We're trying to work that out. Thank you.
What did President Zelensky tell you?
So once again, President Biden here from the White House talking about the new website. You can see it right there in some of the back boards there, covid.gov. They're billing it as sort of a one-stop shop website where people can go get information about testing, about vaccines, about treatments, all in one location. The president also talking about expanding their test to treat program, where if you have symptoms, you could go to a pharmacy or to a location, get tested in one place, and if you test positive, they could provide treatments for you there as well. But really, the president with that urgent plea to Congress to act on COVID funding as we enter the next phase of this pandemic. He highlighted things like monoclonal antibodies, which will run out of funding in the coming months here. He also talked about testing, being prepared for the next possible surge. He said, we can't wait until we find ourselves in the midst of another surge to act. It will be too late. Pleading with Congress, he said, Congress needs to act now, please. Let's go ahead and get to our senior White House correspondent, Mary Bruce, who's there at the White House. And Mary, this has been a real fight because the White House and the president, they want to stay on offense against this virus.
They do. And, this was really a chance for the president to step up the pressure on Congress, urging them to pass billions of dollars in this emergency COVID funding. You heard the president there arguing that without this funding, the progress made so far could be at risk, that the tools that Americans need as we enter this next phase could really be in jeopardy if Congress can't get its act together. The White House is looking for more than $22 billion, and this is currently stalled on the Hill because Democrats within the president's own party can't agree on where this money should come from. And some Republicans argue that additional funding simply isn't necessary. You did, though, hear the president outline the real risks here. And some of this funding, Whit, has already started to run out. Funding that covers testing and treatment for uninsured Americans has already run out of money. That means that some people are already having to pay more than $120 if you go to get a PCR test from a private lab. Funding that covers the cost of administering vaccines for uninsured Americans, that runs out next week. These are changes that really could impact uninsured Americans very hard. It would have an outsized impact on communities of color, low-income Americans, and the president is making this urgent plea because he says time is running out. Essentially, it's not just about entering the next phase and making sure that Americans are well equipped, but also a concern of what happens if another Omicron-type surge hits the U.S., that we are prepared for this. You heard the president say bluntly, this isn't partisan, it's medicine.
Anyway, we saw him listing a few other things. He talked about monoclonal antibodies by the end of May. That funding for that could run out. Testing, funding that we're not going to be able to sustain the testing capacity beyond the end of June. So a variety of things that they're looking to, urging Congress to act. Mary Bruce, thank you. Mary Bruce, thank you so much. I appreciate it. I want to bring in our chief medical correspondent, Dr. Jen Ashton, because we saw the president there get his second booster shot, his fourth shot total. This is something that there's still some disagreement within the medical and scientific community about whether or not people should get it. But if someone's out there 50 and older and they're considering it, what should they be thinking about?
Well, I think the real issue here, Whit, is the CDC and the FDA clear that it is an option. They're using the word offering it to adults 50 and over who are 4 or more months after their second booster shot. We have to remember there's a big difference between public health recommendations, which ideally go out to 330 million people, and the individual doctor-patient relationship relationship or recommendation, which really has to be stratified based on the individual person, where they live, how old they are, what risk factors they have. But I think the name of the game here is we're seeing the White House, the FDA, the CDC make a proactive maneuver here. As the president said, it doesn't mean this pandemic is over, so we have to be able to walk and chew gum at the same time, which means go on with our life, which we all want to do, but keep our eye on the horizon and what may be coming. And clearly they are concerned with future variants, future surges, and they want people to have the option of being as protected as possible.
And again, as we've seen, this Omicron subvariant BA2 cases starting to tick back up in some parts of the country, and the White House and others trying to stay ahead of it. Again, only for 50 and up to get that second booster shot
at this
for now.
point, correct.
Exactly. Dr. Ashton, thank you so much. We appreciate it. And a programming note, a special edition of 2020 airs tonight. 24 months that changed the world, that's focusing on the challenges of the mental health crisis 2 years into the pandemic. That's tonight at 10 Eastern here on ABC and available tomorrow on Hulu. Our coverage continues on our streaming service, ABC News Live and abcnews.com. You can also get breaking news alerts on the ABC News app. I'll be back here with a full wrap-up of the day's news on World News Tonight. I'm Wade Johnson in New York. Have a good day.
This has been a special report from ABC News.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.